I'd like to ask the other participants in the panel to come on the screen and also introduce Riyad Farah from Lebanon, who is from Riyadh, as the really the instigator and organizer to have us have these sessions. I'll mention that in the question and answer area, the bulk of the questions are in the context of data analysis and collection and analytics, which is itself an entire webinar, or 2 or 3 or 5, and the question of public-private partnerships. How do private companies participate in these efforts? I think each of those areas are really fertile areas for discussion in future sessions, because they are big discussions, and what the government brings, what the physicians bring, what the engineers bring, what the computer scientists bring to this exercise, what entrepreneurial capacity and capability bring, are all unique and all have to be blended together. I'd like to move to the part of the discussion that is talking about how can we work together as a community of passionate advocates and seasoned professionals to both improve the progress in Saudi Arabia, learn from the progress in Saudi Arabia, and also support the World Health Organization, support all of our other brothers and sisters around the globe. And maybe we'll turn to all of you from Saudi Arabia, perhaps, to tell us what can we do to support you best? What kind of topics, what kind of webinars, what kind of resources would be most beneficial and useful for you?
Would you like me to start?
Yes, please.
Yeah, okay. Prof, I think we are really learning and benefiting from the successful use cases that's happening here and there. And the knowledge and the benefit from, we benefit a lot in our program from understanding what's have been done in Canada Health Info Way. They were even working with us as a consultant and support us. We all read the documentation that have been done in NHS, and also thankfully you, Prof, and for example the IHE respectful team and those who are working in non-for-profit organizations to build up these standards and maintaining, supporting. So I think expanding, the knowledge, I think, of these core components, the availability, for example, IHE giving more and more sessions in certain areas where we have collaboration with FIRE. We can also do that. It looks technical, but actually our colleague engineers from different perspectives, they need to understand how these things working. They don't know to go into the technical, the coding, how data will move in the wires, but at least they need to, not they, because we are all learning together. We need to understand within my system what specification I should insist to have, and if I am running something else, what should I do? And also some of the successful stories and use cases, like some use cases that utilize artificial intelligence, for example, in building some algorithm at certain area. Understanding this optimum outcome will really encourage our colleagues everywhere to commit to these types of standards, to enforce having these standards in their organizations, and encourage them actually to innovate more. From our side also, we can give some demonstration about the areas where there are chances for the private sector to contribute and collaborate. I mean, as private sector with their solutions, having a working space, having a unified record, so they can integrate with some of the resources, the services in that engine, and provide an additional services for the patients, and to keep the innovation door open and these are some thoughts.
So one of the attendees suggested success stories, which are related to the use cases. The use case may be how to help a person who is living far from a major city. But then what is a use case? What are some success stories? How has this been done with apps, with text messaging, with AI, chatbots, etc. So that we have a library of knowledge and experiences to draw from. Very good suggestions. Majid, do you have suggestions of webinars or training or dialogue that would be helpful for the Clinical Engineering Society?
I guess yes. I think we need a webinar on best practices on actually how we have a tendency here in Saudi Arabia to buy usually the state-of-the-art equipment and the latest technologies, which is somehow it's nice, but giving now the new budget cuts and the new trend of having an efficient spendings, I think if we can manage to have some webinars on that matter would be great.
Okay. I should point out that, to clarify, that Dr. Balkhair and I serve on the IHE International Board of Directors, and IHE is integrating the healthcare enterprise. And in that context, we collaborate with HL7, which has what's referred to as FIRE standards, and also has we work with DICOM and the radiology societies for imaging and pathology. So we share a common interest in these standards, these best practices, these methodologies. And I think we can humbly also admit that the area of regulation, what regulatory standard exists for an AI expert system? We don't have that. You don't have to look any further than the disaster that Boeing had with their 737 MAX to realize that artificial intelligence is way out in front of regulations, but that's typical for innovation. Even apps and app quality. There are 150,000 health-related apps in the app libraries, and there's no agency that puts a measurement on an app and says this is great for diabetes, and this is not so good for diabetes. So there's a lot of learning. There are success stories. I think Saudi Arabia is the source of many success stories. I think that the U.S. has had certainly a number of success stories, and part of Tom's role as the chairman of the IFMBE CED is to pull together success stories. And by the way, there's a new concept that has come forward from Harvard Business School and others called reverse innovation. And reverse innovation conceptually is learn from the low and middle income countries who have created low cost, effective, efficient, safe solutions and integrate them. Don't be too proud to use their solutions, which may be simple and humble, but they work and they save lives. And Majid, that talks to your point as well about, we all kind of like the bright, shiny object, the latest new PET scan, the latest new IBM artificial intelligence, but there are other very important innovations in simple things like masks. And we are all subject to this reality that by Zoom, you can see me smile, and you can see me frown, and you can maybe see me, look sad. But once you put a mask on, all of the human contact is lost. Much of the human contact is lost. So, yes.
Just to add something, because now I was so enthusiastic listening to Dr. Balkhair. There are lots of ambitious projects in Saudi Arabia. So the need is huge. The vision is big. The Clinical Engineering Society in Saudi Arabia is expected to deliver a big amount of work, because having a big vision is something, and implementing them is something else. So what I'm seeing, a big vision, lots of projects, very ambitious projects, and clinical engineers in Saudi Arabia are expected to deliver a very high quality, very competent clinical engineering services in IT and in biomedical engineering. And through IFMBE and through you and Dr. Belkhair and all the experts, we can connect the need with the resources, and hopefully with the set of webinars during next year, this will help elevate the competency. They are already competent, but this will elevate what is needed so that everybody can work in his spot, in his hospital, in his society, in his area, and deliver and share so that the overall vision is implemented properly. I'm so excited in the AMRO unit of IFMB. I'm expecting a big amount of work, and there is a big need for sharing knowledge. And hopefully the next webinars would be more and more dedicated to the exact need, and not only technicalities, but also leadership and competency as well.
Very good observation. Thank you. The G20 document, I think, also shows some inspirational concepts of what we could do. And maybe some of the discussions we might have in a future webinar is looking at some grand challenges that we would collaborate on short term in the coming year to find solutions. I'm sure telehealth is one of those areas. And although telehealth right now by Zoom is certainly much better than anything we ever had, we also know that asking a patient to tell you approximately what their blood pressure is or what their last remembrance of their weight is not a very scientific way to get to precision medicine. And we know we have sensors, we know how we have wearable and low cost consumer products, but we don't have that connection yet. And maybe we can look at some realistic ways to make that happen using the skills of physicians, digital health, clinical engineers, respecting that these devices might be inaccurate, that they might be damaged, that they might be untrustworthy. How do we build the trust up to the point where physicians can do their jobs, the Ministry of Health can do their jobs, patients and caregivers can do their jobs? Those are areas that is teamwork. Those are collaborative opportunities. And at the core are a number of standards, a number of technical standards. I mean, we know how to move data anywhere in the galaxy. We can move ones and zeros to Mars. We can move ones and zeros to the sun. And we can send them, we can bounce signals off the moon. So it's not the ones and zeros that are the problem. It's the agreement among us to count them and how to count them. So we have tremendous opportunities together. I see you smiling, Dr. Belkhair, so you may have some thoughts about that.
Yeah, also I may also suggest sometimes when you have, in all our countries, we have a lot of gaps that we need to fulfill. And the organization, I think when I saw HE and how much they are working actually non-for-profit and delivering such a standard that really easy and you can implement very fast. I think we can do a lot. And I believe, for example, such a document with the 11 recommendations that I mentioned, maybe your organization can work either in collaboration with WHO, with GDHB, or they might select some of the remaining 7 items that need to work on it and then give hands on it. Sometimes some of these recommendations doesn't pull the interest of the big organization because it requires a deep technical as well as interest at certain area. And it's very important. If you look into the journey of now the COVID, it do have a great requirements to orchestrate the area related to the testing, for example, and screening. And how, for example, now if you would like from the technology use blockchain, but how we are going to use this test on the airport, or is it prior to the fly, or is there something that we can do a fast test that's really, and so on. So I think there are certain items that you, among the different specialties and maybe sub divisions that you have, gonna have an impact if you really look into these items and give hands at areas of it. I believe so.
Very good. Very good comments and observations. And your comment about the airports and air travel is another example where clinical technologies are going to become part of air travel and cruise travel and international travel. And those are all clinical technologies that need support. They need calibration, repair, they need quality standards, and those are all shared responsibilities. We have a big challenge ahead of us. There's no question. Majid, perhaps you can help us close with any specific thoughts or guidance. And Tom, I'll invite you as well on the global clinical engineering with any guidance for how we can best work together as engineers with our physicians and ministries of health.
If I may add one more thought.
Yes.
With all of these emerging new technologies and like new techniques, I think one of the issues that we need to address as well in the future is the cyber physical security and as well the ethics in regard of these.
I'll lose all the rest of my hair. Yeah.
I think as some of you mentioned earlier, like having like grand challenge that we can work on it together. I think that would be a great start, and we can take things forward from there.
We are experts here on voting technology, obviously. You're right. And Tom Judd is based in Georgia, which is currently the subject of some of that litigation. So, Tom, would you like?
Elliot, I won't share about that, but I will share that three things. You know, all these topics, AI, cybersecurity, telehealth, and so forth that we've been talking about. You've already heard that we've produced some programs in collaboration with many folks around the world this year. But it wasn't, and by the way, Elliot at our Rome Congress last year issued a grand challenge around telehealth to do what you're doing in the kingdom. And we need to replicate that in other places around the world. But then COVID happened, and so that stepped up our game, you know, to work with WHO to make that happen. I mean, I think of our colleague in Pakistan, Tazeen, I believe, is on this call. She was, you know, a leading clinical engineer in a hospital, but she was invited to the Ministry of Health to work on that. So, I mean, this is happening around the world. So what webinar, you know, so what we want to do in 2021 is follow up with these webinars this year with some key next steps. So, I mean, maybe we highlight your program in one of our webinars for the globe next year, early next year, Dr. Bakir. So next steps in webinars is one thought. You know, it's been an interesting week for all of us, and not talking about the voting at the moment, Elliot, but talking about, you know, sitting in on this, all these innovations that came into WHO since March. And I am privileged among 30 others to be a part of a team looking at those from all the different regulatory and all the different angles. And so those will affect that air travel and clinical technologies on air travel, Elliot, and other things like that. It'll affect the ventilators that, you know, countries produce because they don't have enough, so they go innovate new ones. It'll affect all the oxygen systems, PPE, all that kind of stuff. So let's work together around innovations besides webinars. And the third thing, privileged to sit in on, as I mentioned earlier, the telehealth, what's going to be presented at Global HIMSS in Las Vegas next August, and looking at those 70 proposals out of 700 that came in. I'm not giving away anything to tell you that. So 17 different topics, areas at HIMSS, but you know, fully 10% of them are around telehealth and what's new and late breaking around that, because we know that's the new normal in healthcare. So all the different angles around telehealth, these are all things we can explore together. I'm excited about it. Back to you, Elliot.
Excellent. We have had a wonderful webinar with all of your support. Just express my gratitude for your enduring friendship and partnership in solving healthcare's needs and our community's needs. We're all humbly challenging these great areas, and I'm pleased to say we're making progress, and each of you makes an important contribution, and that includes all of you on the webinar and on the phone and on the YouTube channel. We have gone over. Thank you for indulging us in this extended session, and I eagerly look forward to having additional sessions and making progress in 2021. I wish you all safe end of this month, and to your families, peace and wellness. And again, thank you for all the things you do and your partnership in this space.
Thank you very much, Elliot, Tom, Dr. Ahmed, and Mr. Riyad. Thank you very much. It was a really great opportunity to meet all of you, and hopefully this is just the beginning of the series of the successful collaboration.
We hope so.
Thank you. Thank you very much.
So. Thank you.
It's a pleasure and honor to be with you today.